Welcome to today's Explainer. If you are a focused learner looking to understand exactly how to optimize physical activity as the human body changes over time, well, you are in exactly the right place. I am absolutely thrilled to guide you through this because we're going to dive straight into how the rules of the game for exercise actually have to adapt as we age. We're going to look at the hard data, the proven guidelines, and exactly what is happening physiologically as we move through entirely different life stages. Here is our roadmap for today. We're covering 4 highly distinct states: active youth and adolescents, safe exercise during pregnancy, moving through back pain, and finally, training for older adults. Let's jump right in. Throughout this explainer, you're going to hear us return to one concept over and over again: the FITT principle. FITT stands for frequency, intensity, time, and type. This framework is literally the gold standard for exercise prescription. It's going to anchor our entire chronological journey today, showing us exactly which dials we need to turn as our bodies change. All right, Section 1, Active Youth and Adolescents, Building the Baseline. When we talk about building a baseline for lifelong health, remember that kids aren't just tiny adults. They have completely different physiological needs. For instance, their thermal regulation is actually way less efficient than ours, meaning we have to pay much closer attention to heat and hydration. But when it comes to the activity itself, memorize this headline number. Youth need at least 60 minutes of moderate to vigorous physical activity every single day, not just a couple times a week, daily. Now, if you're working with a kid who is currently inactive, it's totally fine to start below that mark and build up, but 60 minutes is the ultimate daily target we're shooting for. Okay, let's bust a massive myth right out of the gate. For decades, the conventional wisdom was that lifting weights stunted a child's growth. There's just no way around it. That's totally false. The absolute fact is that resistance training is perfectly safe for kids. They can use their own body weight, resistance bands, and yes, even actual weights as part of those 60 daily minutes, as long as they have proper form and adult supervision. Muscle and bone strengthening activities with impact like jumping and skipping are absolutely crucial at this age. Moving on to Section 2, Safe Exercise During Pregnancy, Adapting for 2. So, navigating pregnancy, a woman's center of gravity literally shifts forward because of the growing uterus, which presents a huge balance challenge and a much higher fall risk. On top of that, a hormone called relaxin kicks in, increasing ligament laxity and causing joint instability. Because of these rapid changes, we have to adapt. The crucial number here is the ACOG recommendation. That's the American College of Obstetricians and Gynecologists. The target is a minimum of 150 minutes per week of moderate intensity exercise. Usually that's spread out as 20 to 30 minutes a day on most days. Hitting that 150-minute mark offers some incredible benefits. It lowers the risk of excessive weight gain, preeclampsia, and gestational diabetes, all while promoting an easier labor and recovery. Now, this is where things get really fascinating. Baseline physiological responses completely change during pregnancy. Even sitting completely still at rest, a pregnant woman's heart rate and blood volume are significantly increased. Meanwhile, blood pressure usually shows no change or it might actually decrease. And during weight-bearing exercise, things like cardiac output and minute ventilation jump up way higher compared to a non-pregnant state. Because these baselines are so elevated, we absolutely have to adjust our monitoring and stick to submaximal testing if we're assessing fitness. Because of all these internal shifts, we've got some specific precautions to keep in mind. Let's break down the logic behind the supine caution. Basically, if a pregnant woman lies flat on her back, the supine position, after the first trimester, that heavy uterus actually compresses a major blood vessel called the vena cava. This compression leads to a severe drop in venous return, which drops cardiac output and causes low blood pressure. The physical position directly triggers this physiological chain reaction, which is exactly why supine exercises have to be avoided later in pregnancy. We also have to be hypervigilant about safety. Red flags like vaginal bleeding, dizziness, headaches, or calf pain and swelling, those mean stop exercising immediately. But pay really close attention to this one, dyspnea, which is just the medical term for shortness of breath before exertion. Feeling winded during a workout is totally normal, but being short of breath before you even start moving is a major warning sign. Experiencing any of these symptoms means halting activity and checking in with a doctor right away. Next up, Section 3, Moving through back pain, the active approach. We had to include this special consideration because low back pain has a staggering 84% lifetime prevalence. That means there's a massive chance this applies directly to you or to someone you care about. It's one of the most common physical ailments on Earth, and about 85% of cases are considered nonspecific, meaning there's no obvious anatomical cause. When we categorize back pain, we look at the timeline. Acute pain is anything under 6 weeks. Subacute is that 6 to 12-week window, and chronic is anything stretching past 12 weeks. While 90% of people who see a primary care doctor for back pain recover within 3 months, there is a fascinating, if a bit frustrating fact you need to know. Previous back pain is actually the single strongest predictor of having future episodes. When we evaluate movement during a back pain flare-up, we are watching for two very specific clinical responses. Centralization? That's good. That is when the pain actually retreats from the leg and moves back toward the spine. Movements that cause centralization, like prone press-ups, are highly encouraged. On the flip side, peripheralization is bad. That's when pain spreads further out into the lower limbs. Any activity that causes peripheralization has to be strictly and immediately limited. Let's shatter another major myth right here. For years, the standard medical advice for a bad back was to lie in bed for a week. Sounds like a nice vacation, right? Actually, it is terrible medicine. The modern biopsychosocial model flips that completely upside down. The golden rule today is to stay active within your pain limits and absolutely avoid extended bed rest. The data clearly shows that progressive aerobic training and resistance training are equally effective at reducing chronic low back pain. Activity is the cure, not the enemy. A quick but absolutely crucial reminder on professional boundaries here. Diagnosing and treating low back pain is strictly outside the scope of most exercise professionals. If you're a trainer, your job is to guide safe movement. If a client shows red flags or symptoms of serious pathology like an infection or a fracture, you have to refer them out to a licensed healthcare provider. We use exercise to manage and improve function, not to diagnose medical conditions. All right, bringing us to Section 4, Training for Older Adults, the Multi-Component Era. As we get older, that old, simple formula of just going for a jog or lifting a couple of dumbbells just doesn't cut it anymore. Older adults need a truly multi-component program. Aerobic exercise alone just isn't the whole pie anymore. We still absolutely need aerobic and resistance work, but neuromotor balance training becomes a top, fundamental priority. Dedicating a significant chunk of time to balance is non-negotiable now, because reducing the risk of falls is literally life-saving in this demographic. So to actually implement this multi-component program, we have to tweak the FITT framework. First, we prescribe intensity relative to the individual's current fitness, usually relying on a 0 to 10 effort scale. Second, and this is huge, we must include power training. Muscular power actually drops off much faster than pure strength as we age, making fast concentric movements absolutely vital for everyday function. Third, flexibility stretches need to be held a bit longer, for 30 to 60 seconds. And lastly, if chronic conditions make hitting that 150 minutes a week impossible, remember that any activity beats none at all. Because fitness levels in older adults vary so wildly, we completely ditch those traditional push-to-exhaustion treadmill tests. Instead, we use functional test batteries. We use tools like the Senior Fitness Test, which includes the 30-second chair stand, or the SPPB, which looks at gait speed, chair stands, and balance. These tests are brilliant because they don't just measure raw fitness. They are incredibly accurate predictors of true life disability and institutionalization. Even standalone metrics, like a simple walking speed or grip strength, tell us volumes about someone's physical trajectory. And that brings us to this absolutely crucial takeaway from the source material. Across all of these populations, whether we're talking about a 10-year-old kid, a pregnant mom, someone rehabbing a bad back, or an 80-year-old trying to dial in their balance, the underlying FITT principles, they stay exactly the same. Frequency, intensity, time, and type always apply. What changes is how you adjust your starting point, your rate of progression, your monitoring tools, and your environment to match the unique physiology of the human being right in front of you. Which brings us to the end of this explainer, but leaves us with one really practical question for you. Based on these shifting rules of the lifespan we've just covered, how are you going to adapt the FITT framework for your own routine today? Are you going to add in some balance work? Or are you staying active through a back flare-up? Take these guidelines, apply them directly to your own life, and keep moving forward. Thank you so much for learning with me today, and keep making those informed adjustments.